Hello everyone, so I'm back again. I hope you all are well and you're safe with your families at home. Today we're just going to talk about the question and answer session from the acne video which we did. Now, there were so many questions. I've tried to kind of skim it down. Few I will answer today, and rest I've kind of generated 2 more live purely for the question and answers for acne related things, which is every Sunday, same time. The first question was, does it matter what type of acne you're suffering from? So yes, it does matter, because apparently not every acne has the same treatment, and the reason to have the acne could be different. Most of the time it's similar, but so for example, there is a condition called acne keloides, which is more common in hair, and that's not because of increased oil glands, so it does matter. And there is another acne called acne excoriae, which basically is purely because of constant scratching, which causes trauma and scar tissue formation. So this acne, which is the teenage acne, is mainly what we call acne vulgaris. So this is what I'm going to focus. And certainly I'm very happy to make more videos about specific acne types. Now, there was another question that can acne vulgaris and acne rosacea, can you have it both at the same time? Yes, you can have it. So most of these, I think the best way to understand it is if we divide that into inflammatory acne and non-inflammatory acne. So most of these acnes, like acne rosacea, acne vulgaris, they are inflammatory acne. So once you already have an inflammation, you can have another condition mixed together. So somebody then asks, does it matter then what treatment you're on? I think it again is important to know that what type of acne is worse, and how is your skin foundation or the underlying skin is actually. So now the other thing was, somebody has asked that, excuse me, sorry, I've got a bit of a sore throat going on. So somebody has asked that if, can I summarize again about acne? So I think I don't want to go over again and again. So please watch the other video. I will repost the first acne skin education video anyway. Please, you can just watch that. So I'm not going to go through that. Now, diet. There were so many questions about diet and acne. Does diet affect acne? So acne is not a condition which is directly linked with diet. However, certain diet can make your acne worse. So for example, if you eat more carbohydrates, that carbohydrates, they are inflammatory anyway. Similarly, sugar, similarly high protein shakes, they tend to clog up the pores and they cause background of inflammation. So remember that acne is an inflammatory, most of the time it's an inflammatory condition. Other than maybe it's like if it's a nodular acne, which I will cover later on. So if you already have an inflammation, and eating the food which is going to break down and give you more inflammation, it will not help. So certainly going on a low carb diet is really good. There's certain other conditions which are inflammatory conditions like psoriasis as well. We actually recommend low carb diet as one of the key factor to control the skin. So yes, that is helpful. The other stuff was like junk food. So yes, junk food is not healthy. Pizzas, pastas, they all are usually bad carbs. No, it's not going to help, and they cause a lot of dryness and dehydration to skin. And if you remember that skin is an organ and it breathes, so if it's not hydrated, it's not going to breathe well. So it's a no. Then I've already touched in my first video about the omega-6 rich food and the protein shakes. So I'm not going to say that again. I'm not going to cover that again. Now, there was another question about that what if you have, somebody asked me, what if you have more testosterone in your body? Does that mean anything related to acne? So yes, maybe if you have a high testosterone in the body, what it does is it actually produces more oil in your body. And if you see that, if you remember what we discussed in the first video, that acne is purely because of the excessive oil glands. So yes, that can have a knock-on effect. Yes, the oral steroids, or especially the bodybuilders, they can have further acne problems because of the oral steroids. It works exactly the same way, which I've mentioned. It can have a knock-on effect on the testosterones as well. Plus because of the excessive exercise, they sweat more, and the more you sweat, if you don't then take shower, or the pores will clog up faster than normal. So yes, they all can have an effect. So other than that, banana peel, somebody has asked me. So bananas are rich in vitamin K, but also they are meant to be what we call is like an anti acne products. People call bananas as anti-acne powerhouse. So that's why the peels are very common. You can try it, certainly. But I think one of the most important thing for any peel, if you go, you have to be careful that the peel causes the top layer of the skin, which is the protective layer, which is important to keep the barrier function of the skin. So we actually break down that barrier function anyway. So if you have an active acne underneath and you go for either a banana peel or a sulfur peel or other types of peels, there's so many available, then maybe having it at the wrong time is going to mask your acne, and it will facilitate the bacteria to spread faster. So you have to be extremely careful with that. Now, there were so many questions about the benzyl peroxide, which I did touch last time. So what is benzyl peroxide, and how does it work? So benzyl peroxide is, in simple words, is an antibacterial, which simply means that it protects your body against bacteria. Now, if you remember again, we've already discussed that in acne, the main problem is the normal skin-friendly bacteria. It starts misbehaving. So when it misbehaves, it then fires at high rate. So then benzyl peroxide is good because it tries to cover the bacteria. Now, it is available you can buy over the counter. It's not very expensive, and I think it's available everywhere in the world. You don't have to see a doctor to have benzyl peroxide. There are few things you need to be careful. It comes in gel, cream, and lotion forms as well. And people can use benzyl peroxide for acne breakouts on the face or on the neck or even on the body as well. So if you don't have an acne breakout on your face, but you suffer with breakouts on the back because of gym or because of exercise or any other situation, you can still use benzyl peroxide. It's better if you have a cystic acne as compared to other types of acne. The reason behind that is because as I've mentioned, the acne is inflammatory and non-inflammatory. So when we talk about the inflammatory acne, this is the cystic acne which we're talking about, when there is inflammation already happening, and the pores have got an active bacteria which is firing, and which can then give you infection, and the pores they're more infected, and that's where they say, well, these big spots, I'm having a breakout, but the spots are getting bigger. So these are more cystic rather than other types. So if you have one of those which is active, yes, benzyl peroxide will work. Now, what exactly it does, it works in kind of 3 different ways, many other ways, but just to kind of make it simple. It get rid of the dead cells. So if you remember, we did discuss about the layers of the skin. So the top layer, we have all the cells which are accumulated and they die. The new cells they generate, it takes about a month, minimum 28 to 30 day cycle for the new cells to come from the underneath layer to go to the top. Now, If the dead cells are stuck there for either an inflammation, for because of an infection, because of dryness, then the cells underneath, they will get trapped. Now that further will clog up the will further clog up the pores. So imagine that in acne you have a problem with the pore which is already kind of quite blocked, and then you're using a product which can also clog up the pores. So you have to be very careful at what stage you are using benzoyl peroxide. But usually it's like a first line for mild acne to moderate, depending on what strength of benzoyl peroxide you're using. So benzoyl peroxide, so that's the first way how it works to get rid of the dead cells. The second thing, what it does, as I've mentioned, it's an antibacterial, so it decreases, or it tries to control the bacteria. And the third thing, it decreases the oil. So it will give you a lot of dry skin. So, and one of the commonest thing or complaint when I see clients or patients is because inflammation causes dryness, and already, so they feel they don't have a problem with the oil. They put more oil, and it's like and then they use more benzoyl peroxide. So it does not work that way. Now, the percentage of benzoyl peroxide you can buy over the counter, it can range from mild to moderate, from 4% to 10%. It's available. Usually the medical grade skincare, they have 10% benzoyl peroxide, so it is quite strong. Not everybody can handle it. The major side effects, which the commonest side effect, I hardly see anybody without complaining, so it's that common, is that it causes skin irritation, it causes redness, skin starts peeling off. And the reason is because if you remember that the dead cells, the skin is, the benzoyl peroxide is trying to brush it away. So when the dead cells are going, and if you don't know how to control the hydration of the skin in this situation, then it will mask the dry cycle faster rather than regenerate the new cells or hydration inside your skin. It does not work. So irritation, very common. Plus, when you apply the benzoyl peroxide, it increases your susceptibility to have a sun damage for a sun damage reaction. So if you go out and you don't put an SPF 50, it can cause more inflammation and burning. One of the questions somebody has asked, that I'm going for a holiday, it's a sunny holiday, can I use benzoyl peroxide? Well, it's not a good idea, I think. If you have mild acne, it's not going to cause much damage. But yes, you need to use more SPF 50. How often? As often as you want. I'll do another video purely to focus on SPF 50, how to use it. We're not going to touch that today. But yes, when you're away on holidays, because if you remember on the holiday, it's the UVB light, and the rays, the B causes burning. So benzoyl peroxide is also causing burning. Light is causing burning. Acne underneath, inflammation is causing burning. And it's a hot inflammatory area. So if you add all of these things, it's a super burning area present on your skin. It will affect you. Okay. So I've touched all of that. What else? Okay, so certain conditions when you cannot use benzoyl peroxide, yes. So if you have an underlying dry skin condition, which is like an eczema or a dermatitis, which is exactly same. Sometimes people ask that they don't have an eczema, but they have an atopic dermatitis. I did try to cover in the hand dermatitis video that it means same. It's the kind of a similar pathology. So we can again, focus a little bit more. But imagine that when you have an eczema, dry skin, the skin underneath is dry, you're using benzoyl peroxide, which is going to make it super dry. So yes, then it's not good for you, even if you have acne. The other thing is there is a condition called seborrheic dermatitis. In simple words, when people suffer with dandruff, that also sheds on the face, and they can have dry patches on the forehead, behind the ears, around your nose, and eyebrows area. This is the commonest thing to have itchy ears as well. So then benzoyl peroxide is not good because that is going to mask it. So these are the conditions you shouldn't be using it. So I've touched all of that. Okay, so other question was that my doctor has asked me to use benzoyl peroxide and salicylic acid. Can I use it? Yes, you can use salicylic acid and benzoyl peroxide together if you want to. But imagine that they both cause similar reaction in your skin. They work on the same layers of the skin and the purpose is similar. So you're kind of adding another ingredient. And if you are using 10% benzoyl peroxide, which is the maximum strength, and you're adding salicylic acid on the top, you need to be careful. Your skin can go bizarre, especially with redness, inflammation, burning sensations. I see this a lot in my clinic, ins and outs. So what is the difference? Okay, so there was another question, really interesting question. When do we know that benzoyl peroxide is better for my skin or the salicylic acid? So I think if we just, as I've mentioned, if we divide the acne into an inflammatory acne to a non-inflammatory acne, so benzoyl peroxide, because it's antibacterial, salicylic acid is not an antibacterial, but it does try to kind of work in a similar way. So if it's an active cystic acne, benzoyl peroxide is better. If it's not, nodular acne, or when you are anticipating you're going to have a breakout, then maybe the salicylic acid is better in that way. Okay, now other thing is that how do we apply it? Yeah. So when I see my patients or my clients, I tell them that it's a difficult thing to use these products on daily basis, but you need to use it on daily basis. So if I don't suffer with acne, but if I throw these strong chemicals to my skin will respond in terms of red, angry, burning, touching sometimes is really difficult. So you have to build up. So just build up your tolerance, and it's not going to, it is, yes, a bit of a patience game. You can use maybe in a week, maybe you can start using from twice to 3 times in a week. Use it, give it a bit of a gap, use it again. So ideally, I explain, use it at night, because apparently you're not going to go out in sun, so the sun exposure is already less. However, it does not mean that you shouldn't be using SPF 50 during the daytime. And once your skin start tolerating it, then you can increase the frequency and you can use it once every night. Sometimes in few rare situations, we do ask to use it twice a day. I wouldn't go more than twice a day. Even twice a day is a little bit too much to handle. Also, the other question is that if you're using one or the other, and then you're using a separate face wash, which has got any of these ingredients, you're again doubling it up. So it's really important when you get something, just read it, that what exactly you're putting on your face. Okay. So the other question, somebody has asked me about the sulfur mask. I love sulfur mask. And how does that work and what exactly it is? So sulfur is actually quite good. It's similar. It's antimicrobial. So it does tend to reduce the bacterial activity and all of that. And it works better to get rid of the dead cells. Plus it helps with rejuvenation. So I have something to show you. I use a lot of sulfur mask because I do Xenobaji medical grade skincare. I'm a big believer. I use it for my skin as well. I don't have an acne, but I do sometimes use sulfur mask for my skin. So I'll show you this. Not this one, sorry. So that's the Xenobaji sulfur mask. It's really simple to use it, and it gives you a really nice smooth, and it's not very, very expensive either. But for that, you can't buy it over the counter. It's only for professional use. So you have to consult. I'm happy, if anybody wants to consult about that, that's fine. But you need to find a specialist in that and then, talk about it. So now this one has got 10% sulfur in it. So again, the strength is really important. So sometimes when you buy sulfur mask over the counter, the sulfur ingredient in there is already activated, which means that when we leave these products on the shelves, they get oxidized. So half of their action is already gone. So that's why the medical grade skincare, they're FDA Sorry, I'm just looking at the messages at the same time. So they're FDA approved, and they are more strong. So it's important that you must use all of these under this, not supervision, but at least under the advice of a dermatologist or a specialist. Okay. So it's a natural one. Sulfur is present naturally, in our body. What exactly it does, as I've mentioned, it works similar, decreases the oil production, so purely works on the oil glands. That's the main action rather than anything else. It also hydrates the skin too. In this one specifically, they have sulfur and they have glycerin, and bentonite and few other products which are really good, and it not only works to cause dryness in the sebum producing or the oil producing gland, but it also hydrates the skin in the background. So then how I use this one, that somebody else has asked me. So how I use this is I use it, just wash your face with water and apply this everywhere on the face. So I usually tend to say that when you're applying it, make sure that you just cover a bit of your neck area too, and just leave it for 10 minutes, which is enough. When you're starting it, sometimes 5 minutes is enough as well. Once a week is probably more than enough. If I see acne breakouts or people with active acne, I have a lot of, I treat a lot of active acne clients purely with Xenobaji. They have a big range, but you have to pick and choose according to this stage of acne they're on. So if somebody's got like moderate to severe acne, I give them twice a week as well. And it is one of the best products I've ever used for acne, to be honest. So for normal people, you can still use sulfur. As I've mentioned, it's really good. Oil, generally, genetically, people like us who are skin type 4, we genetically have a lot of more oil naturally in our body. So unless you control the oil or you treat the oil, whatever products you are using, they will just stay on the surface and they will not sink down. So once the products are not getting to the right layer of the skin where they're supposed to work, you're going to waste a lot of your money and the products. That's why having a full understanding of which product, which cream you're using and where exactly it's working is vital. Okay, so that's about the okay, so someone has asked this really interesting question: can we make sulfur mask at home? So I think you can make a sulfur mask at home. I looked up on internet. I've never made a sulfur mask at home, but it was like you use 1 tablespoon of sulfur and mix it with water and some oils and everything and make it. Would I do it? No, I wouldn't. Because I think this you don't want the sulfur in these things to again go inside your eyes. It can really cause irritation, and you don't want to damage further in trying to cure something. So and it's not very expensive. I wouldn't do that. Okay, so we done that. Can sulfur grow hair? Yes, sulfur is actually quite good for hair growth, especially lengthening of the hair. So hair has got a protein, the most important, which causes the most important foundation, which is what we call keratin, and that the main ingredient of that is sulfur. So I actually use a lot of sulfur related stuff for hair loss, and amazing results you get. Can sulfur work on pigmentation? It can work on pigmentation. Dark circles, you can use it. That's why, I like to use it. It gives a glow to my skin, and my skin becomes really smooth afterwards. But again, pigmentation, you need to understand where this pigmentation is coming from, which skin layer. So not every pigmentation or dark circles you can get rid with sulfur. Okay, so I've explained all of that. The other question was about retinoids. So retinoids is a bit of a lengthy subject to talk. I think what I'm just going to do is just quickly touch the topical retinoids available, and the questions related to that. Rest I will answer in the next video. So what are retinoids? Now, the first times the retinoids were approved formally to use for acne, I think that was in 1971, something around that time. They are vitamin A derivatives, so they are natural ingredients. They're really good, but they have a lot of side effects. So if you don't know that you should be using retinoid if you have underlying skin condition, I don't recommend to throw retinoid just because everybody is using it. Now, retinoids, yes, there are multiple other things, you have to be careful. So the products which are available, the topical ones, we talk about adapalene, tretinoin, which is really, at the moment it's a big thing. People are using it for skin tightening, for skin rejuvenation, for collagen production, and everything. It is available. Then we're talking about the mixture of adapalene and some other products. Then we're talking about the oral, which are different, which are isotretinoin, alitretinoin. We're not going to talk about today. So what exactly it does, it increases the proliferation of cells and reduces the dead cells. So that's why it causes rejuvenation. Now, one thing which I think as a dermatologist, I see a lot more than anybody is if you use retinoids for a longer period of time, it can give you a retinoid dermatitis, which is quite difficult thing, and it can cause a lot of scarrings as well. So you need to be careful. It will make your skin look amazing, glow, whatever, but it is for a short period of time. It's not for a long period of time. That's why these are prescription only medications. Now, the only thing which is available over the counter is adapalene. So adapalene is a FDA approved retinoid. You can buy it over the counter. And again, it's available in different strengths, in gel, creams. It does exactly the same as I've already mentioned. It's not to use more than 12 years. So, sorry, it's not used under 12 years. So above 12 years licensed to use it. And again, it causes dryness, peeling effect, and redness, irritation, give you photosensitivity rash. You're not supposed to use it if you're pregnant, breastfeeding. That's all. And it can, if you already have an underneath sun damage area, sometimes that can make it worse, because the commonest side effect of retinoid is dry skin. So I think I've covered most of the treatment options, and I don't want to keep it too long. The rest we're going to talk about in next video, which is next Sunday. If you have any further questions, just please send me again a message, and I will try and answer that. Until then, stay safe and just look after yourself. I'll see you later. Bye.